Welcome back, everyone. Physicians at Heart Hospital of Austin recently became the first in the nation to use new FDA-approved heart valve technology.
We're told it will help patients who have a buildup of calcium that can stiffen one of the 4 valves in the heart. So here to explain how this incredible breakthrough works and how the first of its kind procedure went is Dr. Faraz Kerendi, Surgical Director of the Heart Valve Clinic at the Heart Hospital of Austin. So Doctor, welcome, and first of all, congratulations on this incredible news.
Well, thank you. Thanks for having me. And yeah, it's very exciting. I'm happy to be here to discuss it with you.
So explain how this technology, why it's really necessary. What kind of issues were patients experiencing when that valve in their heart isn't working correctly?
So the specific valve that we're talking about is the mitral valve. And when the valve isn't working right, meaning it's either leaking backwards or it's too narrowed and stiff, patients experience fatigue, shortness of breath, fluid retention, and that gradually gets worse and worse. And in the past, the only option was open heart surgery to replace that valve. And for many patients, that's just too high risk. Their anatomy doesn't allow for that to happen, or they have too many related factors that make surgery for them impractical. And so this really is exciting that we have alternative technology that we can use to address those issues.
Can you talk to us a little bit of what that technology involves? I know the other procedure is at high risk, but how does this one lower the risk, if all?
So traditionally people would have to have an open chest approach. They have to go on the heart-lung machine and we stop the heart in order to replace the valve. Well, for some older patients who have too many chronic conditions to be able to have open heart surgery safely, what this procedure allows us to do is to go through a smaller incision between the ribs. We don't have to use the heart-lung machine. We don't stop the heart, and we're able to deliver this replacement valve through a catheter-based technology. So we put a wire and a plastic tube or a sheath across the valve, and then we deliver the new valve through that plastic tube, and then as we withdraw that plastic tube or sheath, the valve then expands and becomes a functional valve. So that whole procedure takes about an hour to an hour and a half, and it's much less invasive and safer for some patients to get through.
And you all were involved in the trial that actually led up to FDA approval for this. So what was that like, working through the trial process?
Yeah, we were. There were actually several trials ongoing for the mitral valve, for these mitral valve replacement products, and this was the first one. We were actually part of all 3 trials. This was the first one to become FDA approved in the United States. So it's very rigorous, these trials, to get through, because the mitral valve is a complex structure, and to enroll patients who satisfy the requirements of the trial was somewhat challenging. These trials have taken several years, and as mentioned, this particular one, the Summit trial by Abbott, was the first one to make it through that process and gain FDA approval earlier this year. And in fact, we were the first in the country to implant a catheter-based mitral valve commercially in the entire U.S., which is something we're very proud of.
Yeah, I want to talk a little bit about that. How was it to be part of the team to do something like that?
Well, as you mentioned, it is a team. None of us do this on our own. It's a team of surgeons like myself, cardiologists that we work with at the Heart Hospital, and other staff who help facilitate getting the patients to the point of having this. So it's very rewarding for us to all work together and get this done. And ultimately, the best thing is for our patients. Some of these patients couldn't be treated otherwise. They would have no other option, literally. And so it's great that we now have this and are able to use this technology to treat people who otherwise wouldn't be treated at all.
You mentioned the patient there. We want to know, how this patient is doing, what their future looks like now, and then the future of this technology for others.
Well, I think if this patient was unable to get this treatment, then likely he would develop worsening heart failure, and his survival would be limited to the next 1 to 2 years with a very poor quality of life. Now he has a functional valve. Even though this is still a surgical procedure that requires an incision, he's passed the operation, he's on the road to recovery, and once he does recover from it, we expect this valve to last 10 years and give the patient a reasonable quality of life during that time. So I think there's lots of patients out there who otherwise wouldn't be treated if we didn't have this sort of technology available to us. I think that's the most exciting part.
incredible work by you and your team. We are grateful to you for explaining it to us. I know so many people, like you said, at home are opening up pathways of hope to some health and some life that they may not have been able to have without this. So thanks for joining us today, explaining it, and we look forward to seeing what your team does in the future.
Thank you for having me.